Okay, so welcome to immunology class. Introduction to immunology. So before we start the immunology, we have to know the anatomy of the immune system. Can you see my slides?
Yes, sir.
Okay, that's very good. So the anatomy of the immune system. So, can you still see my slides clearly?
Yes, sir.
Okay, anatomy of the immune system. Okay, so immunology and the immune system. Immunology is the study of the components and function of the immune system. So by this, it comprises of molecules, cells, tissues, and organs which provide a non-specific and specific protection against microorganisms, microbial toxins. Whenever you hear toxins, it's the same as poison. Then tumor cells. Tumor is the same as what? Cancer cells. So in a nutshell, immunology or the immune system comprises of molecules. Some of these molecules you will see them later. Examples are what? Cytokines, interleukins, and the rest. We have cells, white blood cell, T lymphocytes, and natural killer cell. All those things are cells. They fight microorganisms. Tissues, organs, and the organs. This organ, we have the thymus and the lymph nodes and the rest. They store matured white blood cells. If you have any question, you can let me know. They store mature white blood cells. So the immune system offers specific protection and non-specific protection. Specific means that there are some of the organisms, like if it's a malaria parasite, then specific antibodies will be directed to go and fight the parasite. Then specific antibodies will be generated, or T cells will be generated to fight HIV viruses. So that is specificity. But if you are looking at non-specific protection, they are the physical barriers, like your own body, because of your mucous membranes, your sweat glands, the keratin of your skin, and the rest. Your skin itself, we call it epithelium. It prevents microorganisms from entering your body. So that is what we call physical barriers or non-specific immunity. So we have the immune system is very crucial to human survival, because without the immune system, organisms will eat us up. If somebody is dead, the reason why the person is dead is that his immune system has collapsed. So microorganisms will eat that person up and the person will be no more. So principal functions of the immune system. 1. To protect humans from pathogenic microorganisms. When we say pathogenic or a pathogen, it's a disease-causing microorganism. The immune system also, pathogenic microorganisms, which are called disease-causing microorganisms, pathogenic microorganisms are defined as microorganisms that are capable of causing infection or disease. Then when we talk about what an infection is the ability of a disease-causing organism to enter into a host, or a pathogen to enter into a host, multiply, and stimulate an immune response, or trigger the body to fight it. Then we have a disease. A disease or sickness is a clinical manifestation associated with any infection at all. So we have our immune systems generate an almost infinite variety of cells and substances. Some of these substances are from the outside world or from the environment. So we call them, and the body is able to recognize these outside organisms or environmental agents. So we call it foreign recognition. If your body is not able to, your immune system is not awake to be able to recognize foreign particles or foreign things and remove it from your blood or fight it, then anything entering your body will cause harm to you. So these are foreign recognition, means that the body is able to recognize anything foreign that is entering your body. We also have effector response. Effector response is what? Your body's ability or your immune system's ability to remove or eliminate or neutralize a disease-causing agent or particle. Then, if we talk about memory, memory is what? Let me narrate this. For instance, some of you took the 6 childhood killer disease, the vaccines, or those who have taken coronavirus vaccine. Now, the reason why, if you didn't take measles vaccine, when people are getting measles, you will get it, because your system does not know or is not prepared to fight measles. So when measles comes, it will have what? There will be a manifestation of the disease. But if you take a vaccine, when the measles come, it will not be able to get you. Or when you get an infection, maybe chicken pox, you get it first, and they give you medication, you will never have chicken pox again. Because initially your body did not have memory. Your body did not know the particles causing what? Chicken pox. Lad Edward, I will let you ask your question. Let me explain these things. Your body did not know. What you don't know is what kills you. So if your body is not exposed to it already, and it comes, you will get the infection. It's like a white man coming to Africa. The white man will get malaria parasite infection. Just one bite of one malaria parasite can get a white man to lie in intensive care unit, because their body in Europe, they don't have any malaria parasite there. They have not even heard of it before. You understand? Okay. So that is, so we who are here, because of the frequent biting of malaria parasites, frequent biting of mosquitoes, and we getting malaria upon malaria, we have residual immunity. So our body knows it. So memory cells have been prepared, and these memory cells are able to recognize the organism which caused the disease. When it's coming back again, the body is able to recognize it. So that's what you call memory. But we'll come back to it again. Okay, so this is the principle behind vaccination. That's the memory. So we can see this is Louis Pasteur, and this is Joseph Meister. He is the volunteer for the first rabies virus vaccine in 1885. So somebody, a worker of Louis Pasteur, is injecting this boy with a what? Anti-rabies vaccine. So defense mechanisms of the human host. We have the innate mechanism. Innate means what? Something that is natural to you. Inheritance. That is you. Nobody can take it from you. So we have the first line of defense. It is non-specific. First line is like your body defending you from microorganisms. You know, when you have a cat, then the cat is open, microorganisms will go and infect it. But if the wound is healed, no microorganism can go inside and infect you. So the innate mechanism is what? The first line of defense. It is non-specific. It's able to protect you against all microorganisms. But the adaptive mechanism is what? The second line of defense. It is highly specific and it generates memory, meaning that over here T lymphocytes are being produced, antibodies are also being produced, and they have what? They generate a secondary response. We'll be looking at secondary response in our subsequent lectures. So let's go to cooperation between mechanisms. Let's go to the next slide. So origin of cells of the immune system. So the cells of the immune system are derived from common progenitor cells in bone marrow. When we talk about progenitor, it's an ancestor that gives birth to several others. So we have the common progenitor cells, and they are pluripotent hematopoietic stem cells. So when we say hematopoietic, hematology is what? The study of what? Cells. So we have the red blood cells, the white blood cells. So their stems, the stem cell producing them or the progenitor cell producing them is pluripotent, meaning that it's able to generate different variety of cells. So we have the progenitor stem cells. The first one is what? The erythroid lineage. The erythroid lineage gives birth to what? Erythrocytes. Even look at the name, erythroid. Erythrocytes. Then we have the megakaryocytes. Megakaryocyte produces what? The platelet. We also have the myeloid lineage. And the myeloid lineage produces monocytes, macrophage, dendritic cells, polymorphonuclear cells, or polymorphonucleates, mast cells. Then the lymphoid lineage produces small and large lymphocytes. Okay, so let's look at the lymphatic system. So the lymphatic organs have well-defined anatomical sites and have connective tissue capsule that separates the lymphatic tissue from neighboring tissues. So let's look at it before we come back. So those marked yellow, the yellow lines, these lines around, that's the lymphatic vessels. We have the red blood cell, we have the arteries and the veins and the lymphatic vessels. And the lymphatic vessels play a role in transporting white blood cells, the lymphocytes and the rest, and antibodies also. And they transport them to the lymph nodes. And the lymph node, that's the place where these white blood cells, antibodies are activated, or they are stored, and that's where they are able to fight infections, remove infections from the blood. So you can see them, lymph nodes. But all these things, they are produced from the red bone marrow. The antibodies, the red blood cells, the white blood cells, they are produced here. And afterwards, they are stored in the thymus, the adenoid, the tonsils, the lymph nodes. So the thymus is the secondary storage site. So this is the thymus. And the spleen also is here. Matured white blood cells, lymphocytes, they are all stored there, and they fight infections. So when there is any infection, you can even see that if you have a cut or a wound on your leg, you can see that small time your groin here, your hair will be swollen. Abigail, Florence,
Sir.
but you can see that here will be swollen, or it will not be swollen.
Yes, sir.
But when the infection is removed, when you take medicine and it is gone, then the swelling will disappear. Have you realized that, class? Class, have you realized that?
Yes, sir.
Okay. We can continue. So we can continue. Please, I'm upgrading. It seems it's ending. So let me upgrade. Let me agree. Hello?
Yes, sir.
Okay.
Yes,
So
sir.
let's continue.
Yes, sir.
So the lymphatics, as I have explained earlier on, the lymphatic organs have well-defined anatomical sites, have connective tissue capsule that separates the lymphatic tissue from neighboring tissues. We will look at that later. Primary lymphatic organs, they are the red bone marrow and the thymus. And this is the site where T and B cells, or T lymphocytes. T lymphocyte is what? A type of white blood cell that fight against organisms, disease-causing organisms. And the B lymphocytes are the cells that produce what? Plasma cells, which leads to the production of what? Antibodies. So T and B cells become immunocompetent. They become ready to fight infection and able to recognize and respond to antigens. An antigen represents what? A disease-causing organism. So secondary lymphatic organs, they are what? The lymph nodes, the tonsils, the spleen, and they are immunocompetent cells, and immunocompetent T cells and B cells populate these tissues. So the lymph nodes, the tonsils, and the spleen are what? The sites where they are organs which store the matured T and B cells for defense. So they are produced in the red bone marrow or in the bone marrow, and they are stored in the tonsils, in the thymus, and also the lymph nodes and the tonsils. So this one, I've explained this one already. So even in the intestines, we have lymph nodes in the intestines. In the small intestines, the lymph nodes located in the small intestines are called what? Peyer's patches. Peyer's patches. Large intestines also have lymph nodes. Adenoids and tonsils also in the throat. You can see that these lymph nodes are all over the body. Why are they all over the body? So that in case a microorganism escape the adenoids or the tonsils in the mouth, in case microorganisms escape the adenoids or the tonsils in the mouth, then when they get to the intestines, then the white blood cells and the B cells which produce antibodies located in the lymph nodes in the intestines, called the Peyer's patches, will fight them. In the large intestines too, they are located. So all over the body. So let's look at, so we have the bone marrow, and that's where what produces what? The hematopoietic stem cells. And the stem cells are categorized into what? Common lymphoid progenitor cells, myeloid progenitor cells, erythroid progenitor cells. So there are three progenitor cells, or three ancestor cells: lymphoid progenitor, myeloid progenitor, erythroid progenitor. The lymphoid progenitor cells produces what? The lymphocytes. And the lymphocytes are called B lymphocyte or B cell, and T lymphocytes or T cells. And the B lymphocyte produces what? Plasma cells. And the plasma cells, they are the producers of what? Antibodies. So you can see antibodies, three of them. 1, 2, 3 over here. Can you see the antibodies? Hello?
Yes, sir.
Can you see the antibodies? 1, 2, 3, And this yellow thing is, this yellow round thing is the plasma cell, Okay.
Yes, sir.
Okay, so, and we also have the T cell. The T cell produces what? Helper T cell and also cytotoxic T cell. So we have here the cytotoxic T cell is represented by what? Effector T cell. That is what is effecting the action. We have the helper T cell also, but it's not here. Then also we have what? The natural killer cells. And they are just cells which are non-specific, but mostly they fight against viruses, or they mediate viral infection prevention, or they fight viral particles. So natural killer cells are here. So we have plasma cells producing antibodies, and they belong to the B cells. T cells producing helper T cell and cytotoxic T cell, but here we can only see the cytotoxic T cell or effector T cell is the same, but the helper T cell is not shown here. We have the natural killer cell, which is what? The natural killer cell fighting against viral infections, but it is not specific for any organism. But most of the time it attacks viruses. So B cells and T cells belong to the common lymphoid progenitor lineage. Then myeloid progenitor. The myeloid progenitor cells are what we call the granulocytes. The granulocytes. Why? Because their cytoplasm is full of granules. You can see granules in the cytoplasm. Granules. And the nucleus is multilobed. Most of the nucleus is one. You can see the nucleus for the lymphoid progenitor, 1. You can see nucleus 1. But here, the nucleus is multiple, more than 1. It is multi-lobed. 1 here, 2, 3. Eosinophil has 2 nucleus, 1, 2. So the nucleus, is lobed. It does not mean that it is multiple nucleus, no, but it is lobed. So we have finished the myeloid. So that we are on the myeloid progenitor cells. So you can see the granules. So they are called the granulocytes. An example is the neutrophil, eosinophil, and basophil. They are called polymorphonuclear because their nucleus is multilobed. And so we say they have more nucleus, but it's one nucleus which is multilobed. Eosinophil has a nucleus which is like a spectacle. Okay, so let's go to the erythroid progenitor. And the erythroid progenitor, or the ancestor for red blood cells, is called erythroid progenitor cells. And they give rise to the megakaryocytes. And the megakaryocyte is what? Platelets. Is a cell that produces platelets. Whereas the erythroblast is what? An immature red blood cell which matures or leads to the production of what? Erythrocytes. Then we have other cells produced from the bone marrow, directly from the bone marrow. We have the what? Antigen presenting cells. One is what? The dendritic cell. These ones, they engulf the particle or disease-causing organism and present them to the B cell or the T cell for the T cell or the B cell to kill the organism. So they are called antigen presenting cells. One is called dendritic cell, another is called what? Macrophage. Then the mast cell mediates what we call hypersensitivity reaction. We'll do that one later. Allergic reactions. Mast cells produce histamines. So the histamine will lead to somebody being exposed to a perfume spray. Will be having a lot of catarrh. Because the person will be having catarrh because mast cells will be producing histamines. Okay, let's go to the next slide. We'll finish very soon. Cells of the innate and adaptive immune system. So we have the myeloid lineage, which is the neutrophil. Their work is to what? phagocytize, or they are phagocytic cells of the innate immunity. Eosinophil, principal defender against parasites. So malaria parasites and others will be fought by what? Eosinophil. But the neutrophil fight against bacterial infection. Then the basophil also fights against these malaria parasites and the rest. It works like the eosinophil and the mast cells. So they are called polymorphonucleates because they have what? Nuclei that are multi-lobed. The nuclei is multi-lobed. Not only one lobe, but different lobes. You can see it again. Multi-lobe nuclei. You can see now. Okay. Then the granulocytes, they are also granulocytes because their cytoplasm is full of granules. So you can see the granules in the cytoplasm. But these ones don't have any granules. But these ones have granules. So they are called granulocytes or polymorphonucleates. Okay, let's go to the next slide. So this is Felicia. Is Felicia around? Felicia. Hello? Hello?
She's not in. She's not in.
What about let me check and call somebody. Alice. Alice, are you around? Okay. What's the name for this cell? This cell, what is it? What type of granulocyte is it? Look at the granulocytes here. There are three. Which one resembles what we are seeing here? Which one resembles this? Time is going, hurry up. Who can answer? Hello? It's a neutrophil. Okay, so the lymphatic system, as I explained earlier on, they are what? Fluid and cells in the lymphatic vessels. Lymphatic vessels collect and retain interstitial fluid. Interstitial fluid is what? Fluid located between cells to the blood. Lymphatic vessels also transport immune cells. So if you are looking for B lymphocytes, natural killer cells and the rest, they are located or transported through what? The lymphatic vessels. Initially, I show you the lymphatic vessels. These are the lymphatic vessels. These ones, the yellow threads. Okay. They transport lipids. So lymphatic vessels also transport lipid. Lipid does not pass through the blood. It passes through what? Lymphatic vessels from intestine before it goes into the blood. We have the lymph nodes. The lymph nodes are kidney-shaped organs at intervals along lymphatic vessels. Let's see them. So let's go to the lymph nodes. So you can see there's a lymph node here. Let's go back so that you can see the lymph nodes well. So these are the lymph nodes. You can see them. The adenoid, the tonsils, lymph nodes all over. These are lymph nodes. Let's go. Okay. So the lymph nodes are naive. This is the place where naive lymphocytes circulate between blood, lymph, and secondary lymph nodes. Naive lymphocytes. Naive means that they are new lymphocytes. They are virgin lymphocytes. They don't know any man. They haven't had sex before. So they are virgin lymphocytes. They have not been stimulated or activated. So they are most of the time stored in secondary lymph nodes. So pathogens from infected tissue sites are picked up by lymphatic vessels and arrive at the closest lymph node. T and B cells congregate at specific regions of the nose. Architecture and size of nose change in response to activation of lymphocytes. So let's see. So if we have an infection over here, maybe you had what? A needle prick or a sore or a wound over here. The infection or the disease-causing organisms over here will move, and when they get to the lymph node, then what will happen is that the lymph node has B cells and T cells which fight against the infection. So lymphocytes and lymph return to the blood via the lymph. So the lymph node contains what? Lymphocytes. So when they finish fighting the infection at the knee, then they will return to what? The heart. So this is the explanation. So pathogens from site of infection reach the lymph nodes, that's from here to here. Then they are fought by the T lymphocytes and the B cells. And afterwards, they are cleared from the blood. Then the rest of the lymph node drain into the heart. The right subclavian vein to the heart. So this is an architecture, anatomy of what? A lymph node. So the lymph node has what? Medullary sinus. It's a kidney-shaped structure. We have the artery, the vein, the efferent lymphatic vessel. This is where the lymphatic leaves the lymph node. Anytime you see E, efferent, it means what? It's what? The gateway. That's the outside. Things moving from the organ to the outside. Then the afferent means what? You can see the arrow. Blood moving from outside to inside. So we can see the germinal center is where B lymphocytes and T lymphocytes are activated. Or they are activated so that they can fight infection. And infections are fought over here. So the lymphoid follicle is where mostly B cells are located. Then we also have what? T cells are also located here. So B cells are located here, the lymphoid follicle. Then the T cells are located in the T cell area. Then the germinal center is where they get activated. T cell and B cell get activated so that they are no longer virgin. Their eyes have been opened so they can fight infection. So lymphocytes and the spleen. Lymphocytes and the spleen. So the spleen is also what? A lymphoid organ in upper left abdomen. The spleen, let me show you the spleen. So this is the spleen. Can you see the spleen now? Can you see it?
Yes, sir.
Okay. So the spleen is a lymphoid organ in the upper left abdomen, and it functions by removing damaged or old erythrocytes. So we call it the reticuloendothelial system. The spleen is where red blood cells, after spending the 120 days of life, they are destroyed inside the spleen. Then the spleen is the site where white blood cells or lymphocytes from blood are activated so that they can fight organisms. The architecture of the spleen is what? Red pulp. It comprises of the red pulp and the white pulp. Let's see the red pulp and the white pulp. So this is the spleen anatomy. This is the histology of the spleen. Histology is the study of tissues. So spleen has tissues. So we can see this is the red pulp. That is where the red blood cells reside. And the white pulp is where the white blood cells reside. So you can see the white pulp is white here, and the red pulp is what? Red. You can also see here the transverse section. We can see the red pulp here. Here all is red pulp. Then over here is the T cells. Okay. Then this is the germinal center where they are activated. So primary portals of entry for pathogens. So before a disease organism, causing organism can enter the body, it has to pass through what? The respiratory system, or the air we breathe, or what we eat into our stomach. The gastrointestinal tract, that is the GIT. It starts from what? The mouth to the anus. And the respiratory starts from where? It's from the nose to what? The lungs. So these are the major routes, primary portals or routes where organisms get into the body. Then the secondary lymphoid tissues. So we have lymphoid tissues inside the lungs, and they are called bronchial-associated lymphoid tissues. We have gut-associated lymphoid tissues, which are associated with the GIT. Whenever you hear gut, it's what? The gastrointestinal system or tract. And we have tonsils there, adenoids there, appendix is also there, Peyer's patches is also there. They have a collection of lymph nodes, and the lymph nodes contain what? White blood cells and what? B cells for antibody production and for cytotoxic T cell or effector T cell production to fight organisms. So these sites are, that's why somebody staying at Choco or what do we call it? Choco or Ashama. If food even fall on the ground, they will pick and eat, but they will not fall sick because their immune system is very active. Tonsils and others are guiding the gastrointestinal tract, and also there are some lymph nodes are also guiding that bronchial-associated lymphoid tissues are also guiding the lungs. So pathogens are directly transferred across mucosa. These places, the gut and the lungs, have a lot of what? Mucous membranes or mucous tissues or mucous cells. So these mucous also help in protection of what? The body. Okay. So we have the gut associated or gastrointestinal tract associated lymphoid tissues. So we have the gut lumen here, the gut wall. Germinal center is where the T cell or the B cells are activated. We have whenever you hear follicle, that is where the B cells reside or where they live. Then the T cells also stay in the T cell area. So this is what? A lymphoid tissue in the gastrointestinal tract. Let's go fast. So bacteria, we are almost done. So let me save this. Let me save this recording because I have to save it in pieces. So let me save it so that we continue here. Don't go. Just stay there. If you move, I'll catch you.